Hello, today I'm joined by Dr. Rachael Matthews, who is a neurology registrar at the Walton Center and a member of the Brain Infection and Inflammation Group at the University of Liverpool. She's a recent awardee of the Alzheimer's Research UK Doctoral Clinical Fellowship, and she's been kind enough to talk a little bit about her fellowship today. So, hello, Rachel. Could you tell us
Hi.
a bit, what is your fellowship about?
Yeah, so my fellowship looks at what happens to the brain after serious infections, especially in people who develop delirium while they're ill. And delirium is an acute state of confusion that often affects people during infection. And we know that it's linked to much higher risk of long-term cognitive decline and dementia. But at the moment, clinicians can't reliably predict which patients will recover and which will continue to deteriorate. So my goal is to build a tool that combines brain scans, serum brain injury biomarkers, genetics, and cognitive testing to identify patients who are at the highest risk of ongoing cognitive decline after infection.
That's so interesting. And could you tell us, why is this an important problem to study right now?
Yeah, so dementia is one of the biggest healthcare challenges globally, and we're beginning to see the emergence of new disease-modifying treatments. And these therapies are likely to work best if they're used early in the disease process. An infection-related delirium may represent one of the earliest clinical warning signs that the brain is vulnerable to future neurodegeneration. In some ways, it's really helpful to think about delirium a bit like a transient ischemic attack in stroke medicine. It may be an early signal that the brain is under stress and at higher risk of future problems. So if we can identify those high-risk patients at that stage, it creates an opportunity to monitor them more closely and intervene earlier, rather than only recognizing cognitive decline once it's well established.
Yes, that's so important. And what makes your study unique compared to previous research?
So one of the key strengths of this study is that we already have access to a very large, well-characterized patient cohort with multiple types of data collected, including cognitive testing, brain imaging, blood biomarkers, and genetic information. So that allows us to take a much more integrated approach rather than many previous studies that focus on only one type of measurement. Another advantage is that we're studying patients who were hospitalized with COVID-19, recruited through our COVID-19 clinical neuroscience study. And by using a single infectious pathogen, it really helps reduce the heterogeneity you usually see in studies which look at multiple infections, where many different organisms and disease processes are involved. And that makes it easier for us to understand the biological relationships between infection, delirium, brain injury, and long-term cognitive outcomes.
Mhm. Yes. And what impact could this research have?
So if this work is successful, it could help clinicians identify which patients are most at risk of persistent cognitive problems after infection. And that could support earlier monitoring, referral to special services at an earlier point in time, and potentially earlier treatment as new therapies become available. And there's an increasing number of clinical trials trialing multiple different disease-modifying treatments. More broadly, it could also improve our understanding of how infection and inflammation affect the brain and contribute to longer-term cognitive decline.
Oh, that's so exciting. Thank you very much for explaining about your fellowship, and we're looking forward to see the papers from it. Thank you
Thanks
for
very
talking
much.
to us today.
Thank you.